In today's video, I'm going to talk with you about a move you may not even be aware you're doing. Or maybe you're doing it deliberately as part of an exercise routine, but you didn't realize how dangerous it could be for your lower back, especially if you have a history of lower back problems. Hi, I'm Amanda Harris with Re-Kinect, where we help you get past your limitations and pain and return to the exercises and activities that really move you, even after injury or surgery. So a client did this move in front of me last week very innocently, and the minute I saw it, I knew I had to share it with you because probably a lot like her, you don't realize how dangerous this move can be. But before I get into the dirty details about it, the boring disclaimer. What I'm talking about here is that move where you're lying on your back and you lift both feet or both legs in the air, like you're pulling your knees to your chest, or the reverse where you're taking both legs or both feet back to the floor without any sort of assistance for your lower back. Now, the problem with this is that when you do that move, you're recruiting your big hip flexors, your psoas muscles. You've probably heard that name before. Those big muscles start on your thigh bones and then they attach to every single level of your lumbar spine or your lower back. And then you're also recruiting your big lower back extensors that backward bend you. Now, that doesn't sound like a big deal except for the fact that these two very powerful muscles on each side are pulling equally in opposite directions, putting a ton of force across your lower back. And if you've got a little instability somewhere in your lower back, maybe from an old injury or something like we talked about in last week's video, then you could be at risk for, at the very least, a whole lot of tightness for the rest of the day across your lower back, kind of making you feel like you're being pulled into a backward bend, or worse, some serious cramping and even spasming in your lower back. And trust me, having been through that, you don't want that. Now, there are some very simple solutions to this, but before I share them with you, I just want to say, if you like this content, if you're finding it helpful and interesting, please hit that like button for me and share it with your friends and family who you think would benefit from it. And also, don't forget to sign up for your seat, save your seat, for my free live webinar that I will be delivering at the end of August. The link is in the description below. We're going to talk about what causes and contributes to mechanical low back pain, what makes it stick around, and what types of simple movements and exercises will help you to resolve it and get back into whatever exercises and activities you love. It's going to preview a little bit of my lower back masterclass, and you're going to get a lot of really great information that you can actually get started with right away. So don't forget to get in that description. All right, now the solutions to our little problem here, our little leg lifting and leg lowering problem, are pretty simple. It's just move one leg at a time. So if you're trying to get your knees to your chest, leave one foot on the floor and bring one leg towards your chest. That way the leg on the floor helps to support and brace the lower back a little bit while you're bringing the other leg to your chest. Likewise, the one that you've pulled into your chest can support and brace the lower back while you pull your second leg in. The reverse is true as well for taking the legs back to the surface. You want to take one of them down at a time so that each leg can serve to support the lower back while the other leg moves. Pretty simple, right? Now, if you're looking at this as an exercise, so there's a very old exercise that still gets used today where you hover both legs just off the surface. Let me just say that there are many great abdominal strengthening exercises out there that you can do without jacking up your back. Again, we're going to talk about some of those in the webinar that's coming up at the end of August, so make sure you save your seat. All right, that's all I've got for you this week. Until I see you next time, keep moving and be well.